Now, a study has provided more evidence that obese people are much more likely to die from coronavirus. Researchers at the University of North Carolina at Chapel Hill found obese people had a 48% increase in death rates and are twice as likely to be hospitalised. The US and the UK have some of the highest obesity rates in the world, and the US still has, of course, the highest COVID-19 transmission rate. We'll talk to Dr. Simon Clarke about this, an associate professor in cellular microbiology at the University of Reading in the UK. Dr. Clarke, thank you for your time. Can you give me more specifics on this? Because obesity covers a lot of different issues, different illnesses as well. What is it, or what are the specific reasons that obesity is leading to these high death rates?
Well, we don't actually have a confirmed mechanism for why obesity makes somebody more susceptible to COVID-19. And it does that at all levels. If you're obese, you're more likely to be hospitalised if you have COVID-19. If you go into the hospital, you're more likely to end up in intensive care. And if you end up in intensive care, you're more likely to die compared to somebody who doesn't have or isn't obese. There are a number of potential metabolic reasons why that is. People who are obese tend to be resistant or have some resistance to insulin, so their normal physiology is affected and doesn't work properly. Also, they have a degree of inflammation, and we know that in very many cases, it's the overexuberant immune response that causes damage. That's what often kills people, is their own immune response. And if they're already carrying a naturally high degree of inflammation, then that means their bodies can't respond appropriately.
So then could obesity, and maybe this is more of an interpretive question, but could obesity be almost considered an underlying condition? You know how people with quote-unquote underlying conditions have to be more careful with coronavirus, things like asthma, for example. I mean, could obesity almost be tied into something like that?
Quite possibly, yes. I mean, people who are obese tend to have cardiovascular problems, or are more likely to have cardiovascular problems. And we know that cardiovascular problems are one of the underlying health conditions. So this is all tied up as well. My suspicion is that there are many physiological factors, and people probably have more than one, which make them susceptible or increase their susceptibility to COVID-19 and its worst effects.
Boris Johnson, the UK Prime Minister, I don't know that he would have been officially described as obese, but he was overweight. He got COVID-19. He's lost a lot of weight since then. He's made a big push, hasn't he, about the general healthiness of people. This has to be something that people consider going forward.
Yeah, he's been very upfront about this, about the need for people to lose weight. He's been seen in the papers taking lots of regular exercise himself. And yes, I'm afraid, as palatable as it might be, I think people's weight will be shown, or is being shown, to have an effect on their ability to survive COVID-19. I speak as somebody who's a bit overweight myself, so I know that it's really important for health authorities, it's happening in the UK, to push for people to take more exercise and to watch what they eat.
Good advice at any time, isn't it? Dr. Simon Clarke from the University of Reading, thank you.